Hi, everyone. My name is Avi Meyerstein. I'm a partner in Husch Blackwell's Safety and Health Group. Before we begin, I'd like to cover a few housekeeping items. At the bottom of your audience console, there are multiple application icons that you can use during the program today. If you have any questions during the webcast, please submit them via the question box. We'll try to answer all questions during the webinar as we go. If necessary, we might cover some at the end or even by email if we can at the end if we haven't gotten to all of them. A PDF of the presentation is available in the resources folder, and the program has been approved for legal education hours. To report your hours, click on the CEU icon at the bottom of the screen. A certificate of attendance, including the course numbers, will be emailed to you tomorrow, along with a recording of the webinar for watching and sharing. Toward the end of the program, please be sure to complete our short survey. We definitely value your feedback, and we use it to plan future programs and make sure that they're serving your business needs. So that's it for all the housekeeping items. Why don't we get started with the program itself? Today, we're going to be talking about what to expect from the new Biden administration in terms of workplace safety and health law and regulation. Joining me today is my partner, Eric DeLay. Eric and I work together on workplace safety and health issues. Eric is an expert in administrative and regulatory law. In addition to the workplace safety issues, he also has a deep background in critical infrastructure issues involving mining, energy, and aviation. I also want to give a shout out and a thanks to Leah Kaiser, one of our associates who helped us in preparing today's presentation. With that, why don't we jump right into it? So just to add a note about what we do and who we are, our Workplace Safety and Health Group is a national practice. We're around the country. We help people wherever they are. We like to pride ourselves on being able to respond quickly, especially in the case of an incident. We do serious and fatal accident investigations and defense. We can get boots on the ground within hours generally. Or support you remotely, however works best given the situation. And we like to do a 360-degree defense, and this is part of that. It's helping you get ready, helping you prepare, making sure that your teams know what to do to comply, and then if something goes wrong, how to handle those situations the best. What we're going to talk about today is going to focus on what we're seeing and what we're expecting as of now from the Biden administration. We'll talk a little bit about who will be in charge as far as we know, what rules we expect may be coming down the pike, how enforcement might change, and then we'll touch a little bit on how you can prepare in this environment. There's a lot that we still don't know. Obviously, the administration is really only a few days on the job. New nominees and names are coming out, new policies are coming out, but our hope is that this is an early opportunity to give you a sense of what to expect based on what we know. And then, of course, we look forward to keeping you in the loop down the road. So to start, who's in charge? We do have a nominee for Secretary of Labor. It is the mayor of Boston, Marty Walsh. He's not a stranger to workplace safety and health issues. He's been for many years involved in construction unions. He's been a labor leader. And in terms of this moment that we're in now, it's noteworthy that he has raised concerns over time about making sure that COVID-19 doesn't spread at work. He's considered loyal to workers and unions from his many years in that zone. But also has a bit of a reputation from what we heard as a pragmatist and a consensus builder. Just one example, he's credited with speeding up project approvals and championing small business in Boston. So he is coming from the union world, but hopefully he'll be able to engage positively with everyone around the table. At OSHA, there's a nominee for the Assistant Secretary for Occupational Safety and Health. That's the person who heads up OSHA, and that is Jim Fredericks. He's been with a union as well, the U.S. Steelworkers, for over 2 decades. He's been in their workplace safety and health EHS function. And so in that role, he's been involved in lots of OSHA rulemakings, dealing with the steelworkers' position on a wide range of rules: workplace violence, beryllium, silica, hazard communication, and ergonomics, among others. So he really is well known in the field and very fluent in everything that OSHA does. He's very recently been a consultant to private industry at an independent consulting group, which I think is positive. It shows that he understands how to deal with management and the issues that management faces. And in that sense, I guess he has a bit of exposure to both sides of what is often a two-sided dynamic. It's worth noting that OSHA never had a permanent assistant secretary leading the agency under the Trump administration. There was a nominee early on, but it never went anywhere. And so they had an acting assistant secretary for the entire time. So it probably will be beneficial overall for OSHA to have someone who's got Senate confirmation to be in the seat running the show. Another comment that came out of the International Brotherhood of Teamsters Union about Jim Fredericks just supporting his nomination, mentioning that he's known worker safety for over 25 years through the steelworkers. So he's definitely got union support as he goes into the Senate confirmation process. One more name we wanted to share with you because President Biden has named a deputy assistant secretary at OSHA to specifically focus on COVID-19 and pandemic and emergency response. And this is, I think, a unique emphasis that hasn't happened in the past. The person in this case is Mr. Chip Hughes, is going to be coming out of the NIH Environmental and Health Sciences Worker Education and Training Branch. So he's been focused on developing programs and training for workers involved, especially in hazardous substance response. Think of things like 9/11, Hurricane Katrina, and the Deepwater Horizon oil spill. So he's been involved in helping workers engage in those kind of incidents and putting in place protections to keep them safe. And he's going to play a key role at OSHA, working, of course, with the Assistant Secretary and others as they look at how to deal with COVID-19 in the early days, especially. And again, the Teamsters has put out there a positive quote in support of Mr. Hughes. A quick note about Congress, because they obviously have a role to play as well. As I'm sure you all know, there's a Democratic majority in the House, and with a 50-50 split in the Senate, the Democrats will be in the majority because the vice president becomes the tiebreaker. Now, as of the time that this slide was put together, it was a bit more uncertain, but as last I heard, they're actually now moving forward with putting in place the Democrats in the majority. They were negotiating over whether the filibuster would be completely on the table or whether the Democrats would commit not to removing the filibuster. But in the end, a couple Democrats said that they are not inclined to remove the filibuster, and that was enough to get an agreement to move forward. It's expected that they're going to have a power sharing agreement like the last time it was split. And what that means is that the committees will be split 50-50 in terms of the numbers from each side, but the Democrats will sit in the chair roles in each case. Now, of course, there are committees on both the House side and the Senate side that oversee workplace safety and health and oversee OSHA. And especially in the early period, we'll just call out the fact that the House Democrats have called for legislation to deal with COVID-19 in the workplace. And President Biden actually has called for Congress to legislate about this. And so we'll talk a little bit more about that, but that is the other piece of the puzzle in Washington. With that, I'm going to turn it over to Eric so he can talk a little bit about what might be on the rulemaking agenda from OSHA.
Thanks very much, Avi. I just came off of mute. Are you able to hear me okay?
Yes, hear you loud and clear.
Hey, greetings from Thanks. Hey, greetings from snowy Denver, everybody. Let's continue the discussion on what we are anticipating and seeing as far as OSHA's existing and future rulemaking agenda. And what Avi and I thought made the most sense on this was, in a sense, to start politically at the top of the executive branch and highlight a couple of the executive orders that are going to be relevant to worker safety and OSHA, and then examine what emergency regulations and standards have come out lately, summarize the state programs, and then look at some of the existing federal OSHA standards that have been applied in relation to COVID and for worker safety going forward. So, as most of you who have been watching the news for the last week or so are likely aware, President Biden began his administration with a flurry of executive orders. As of Wednesday of last week, I believe there were 15 that were signed. When I was listening to the news this morning, I believe the total was approaching 30. With what had been published as of yesterday, there were two that caught our attention that we wanted to summarize for you. The first one, coming from January 21st, was announced and titled as Protecting Worker Health and Safety During COVID. This executive order gives specific guidance to OSHA on what the president wants to see going forward. He is looking to have OSHA revise guidance within the next 2 weeks and for OSHA to make a decision by March 15th on whether an emergency temporary standard is going to be needed and whether it needs to address face coverings and masks. He's charged the agency with determining whether there needs to be a difference in the enforcement structure or model that the agency would use going forward. So we are waiting to see what may take place out of that. Two areas that were called out specifically for attention are going to be to have focus look at violations where the largest number of workers are at risk. So if you are a business that has a large employee population in individual or discrete locations, please keep in mind that that focus would be an area that might be more applicable to you. The other one that I want to emphasize is to have enforcement focus on anti-retaliation or whistleblower or discrimination claims against employees who make safety concerns. For those of you that were involved in this space before the Trump administration, you may recall that under the Obama administration, the safety agencies, OSHA and the Mine Safety and Health Administration, both advanced and made easier for employees to access the whistleblower tools that are available to them under the law. It would not surprise us to see that those tools are put back in place that would allow employees to make complaints online from home on a weekend, late at night, whatever the case may be, which generally we noticed prior to 2016 led to a steady increase in the number of retaliation and discrimination or whistleblower complaints around the country. The reason that this is germane to OSHA is that OSHA tends to be the one-stop shop agency that will conduct investigations of employee whistleblower and retaliation complaints. You may have the law that deals exclusively with the aviation industry, Air 21, but those complaints under aviation safety are handled initially by OSHA. Same is true for Sarbanes-Oxley if it were to be related to financials. So keep that in mind that anti-retaliation is something that OSHA is very familiar with, and we do expect it to have greater emphasis for 2021 and beyond. If you are faced with those concerns, and if that is something that you're not familiar with, if you are fortunate enough not to have had to deal with complaints in the past, Avi and I and the rest of our group strongly encourage you to think of documentation. When it comes to a complaint, if you find out if one is brought to you, start taking your notes, treat the complaint seriously, investigate it, and make sure that you are able to provide a response. We can go into much greater detail on those, offline or in follow-up discussions with folks if you have questions. But that is an area that employers that have not handled one before, it can be an eye-opening experience as far as the level of effort and investment of time and resources that goes into responding to try and mitigate the harm or the consequences of an investigation. So with coming back to the order itself, the other aspects that President Biden brought up were for OSHA to be looking at worker outreach campaigns to focus and educate workers on their rights. Doing that with unions is going to be part of that, community organizations, and also with the private sector industry. And then to continue to partner and interact with other agencies at the state or local level, as well as the sister agencies at the federal level that are involved in workplace safety but are not specifically under OSHA's jurisdiction, such as mining or certain aspects of transportation, health, and human services. Okay, the next order, and I apologize, I put this slide together, so you can definitely blame me for not only the material on the slide being dense, but for the topic being a little dry, dense, and obscure. But we felt that this executive order that also came out on the 21st, modernizing regulatory review, could have some noteworthy consequences in how the federal government is going to approach the regulatory and rulemaking process going forward. What the president is directing both his Office of Management Budget and the Office of Information and Regulatory Affairs to do is to transition from a 40-year practice that was first put in place by President Reagan of performing a cost-benefit analysis of what a new regulation will do as far as how it will affect the regulated community. And the president is directing OMB and OIRA, as they're both known, to look at the benefits that are difficult to or impossible to quantify and to include those in their justification or their rationales for updating, revising, or implementing new regulations. And you can see probably halfway down that slide, as far as OMB's recommendations for improving and modernizing, the review should include, and this was a quote out of the executive order, aspirational goals. And I don't mean to trivialize them, but we can probably recognize that these may have costs for employers where the benefits may not be there to help offset it, either for the regulated community or for the public. But they are to promote public health and safety, economic growth, social welfare, racial justice, environmental stewardship, human dignity, equity, and perhaps most interesting, the interests of future generations. So how OMB will articulate those plans remains to be seen, but they certainly may make it more difficult for the private sector or a regulated community to bring challenges to a proposed rule or to question the validity or the benefits that would come out of a rule. So I think this will be a collective learning experience for the country on that, as that is implemented as we go forward. Okay, so going back to COVID and regulations that are already in place or are about to be in place that might be more germane to us for the near future, what would a COVID emergency temporary standard look like? Unlike traditional rules where you have a notice of proposed rulemaking, the language is put into the Federal Register, people comment on it, and a final rule comes out and the agency says, here's why we took your inputs and incorporated them into the change, or here's why we decided that your rebuttal or your concerns did not have merit in the agency's eyes, at least, and were not incorporated. The emergency temp standards, the ETS, will, in a sense, do the opposite. It'll be published first, it will go into effect, and then there will be the comments that will be coming in afterwards with the opportunity to revise. The personal experience or the work that I've done on that lately has typically involved government contracting and cybersecurity rules and regs, where either the DoD or elements of the Department of Commerce were putting out those rules in the last quarter, the last 3 months of the Trump administration to change what sort of telecommunications hardware or procurements the government could do. And those were put out as new rules, said here it is, and then we're in the comment period for those rules now in some cases. Keep in mind that when the federal government and OSHA do this, the way that the Occupational Safety and Health Act was written, state OSHA agencies can have their own plan, but they need to take the federal OSHA rules and regs as the baseline of protection. So a state can have higher, more, and greater protections for its workers, but they need to at least meet the federal requirements. So each time that we are seeing a federal COVID ETS come out, each state is going to have to adjust and adapt to that. Other areas that we may be looking at are more detailed record keeping and reporting of COVID cases that are either discovered or symptomatic in the workplace or are detected as a result of testing. And we may see as well that Congress may take action on this. That remains to be seen. Avi gave you a good summary of how close the political battles are within the legislature, and it remains to be seen where those will go. Other existing guidance that we have, so hopefully you have a slide now that says what did the CDC and OSHA already say. Remember, you need to have a COVID-19 response plan, and you should be implementing and following that plan. There's nothing worse from a compliance and an enforcement standpoint than to have a regulator arrive at your site, say, let me see your plan, and you pull it off of the shelf and you blow the dust off of it. And he or she open it up and start walking through the steps and what you have put on paper and then what the regulator sees in reality at the workplace don't match, because that brings in the factors of what did you know? You've obviously been aware of a condition, but you're not acting to protect your workers. So those are things that you do want to be mindful of. Look at that plan, keep it close, within an arm's reach, and do your best to be following it to the best of your ability. If you are a business that has multiple locations across multiple states, keep in mind that those rules and those regs in each state may be slightly different. So a one-size-fits-all response plan can be beneficial from a consistency standpoint. There's certainly value that needs to be taken into account with that, but it may not work or comply with each and every state where you have your workers. So there may need to be annexes and appendices that would go into those documents and plans to make them applicable and compliant with the jurisdiction where you are. What else do we have here? I think that's going to cover everything on this slide. Let's go on to the next one as we get into existing rules and regs. At the federal level, there has not been a specific, aerosol transmissible disease standards such as we have seen in California OSHA. And in some cases, what they've been looking at and what the federal government has relied on is the general duty clause, which is built into the act itself. And it obligates each employer to provide its workers with a place of work, a place of employment that is free from recognized hazards that are likely to cause death or serious harm. Therefore, you have a foreseeability aspect that goes with that. And keep in mind, it is a requirement that you as the employer are aware of the conditions. So you do need to be mindful of changes in the workplace, changes in the processes, how those things are either working to beneficially to reduce hazards, or perhaps there are measures that were put in place that may not be getting you the return or the results that you wanted, and you may need to look at making minor adjustments in those plans to address and reduce recognizable hazards. There are requirements for personal protective equipment as well. Those things tend to be sort of the lower down in the hierarchy of what OSHA wants to see done, but they are still important. There are, within that, as you were looking at what PPE is necessary, remember that for each particular process and location where you have people working, there needs to be a PPE hazard assessment that was done and certified, such as with the name of who did it and the date on which it was done. And then you need to be training your employees on how to use the PPE that you're providing. You need to make sure that they are wearing it, and then that if it needs replacement, that they are getting it. Eye protection for the jobs that require that. Face shields would be another one, and then gloves for hand protection. So all of those things are already out there that are part of the regulations and would have applicability to the risks of COVID going forward. When it comes to respiratory protection under the existing rules, if you are looking at interacting with people that have COVID, there is that requirement and expectation that employees need to be maintaining at least 6 feet of distance from their patients if they can. But if they can't, they need to be looking at respirators. And that's not a dust mask. That really does need to be that N95 certified or better capable respirator that goes on their face and that is properly fitted for them. A respiratory program, if it is applicable to the job that your personnel are performing, it does need to be a written program. You need to have that written down, and then you need to be reviewing it. Each employee needs to go through a fit testing and training on the proper wear and use and cleaning and maintaining of their respiratory equipment. And you need to have the medical exams that would acknowledge that, and then you need to be maintaining the medical exams. If your personnel are involved with cleaning and disinfecting areas, that's also going to trigger the hazard communication and the safety data sheets that go with those hazardous chemicals, and make sure that the employees that the SDS, the safety data sheet, is accessible, that they can read it, they can review it if they want. Each and every OSHA inspection that I have supported a client on, one of the first document requests that the inspector and the compliance safety and health officer make is, I want to see your HAZCOM program, I want to see a list of all the safety data sheets, and then I want to know where those safety data sheets are kept and how employees can read them. So you need to be able to answer those requirements in short order if you are receiving an inspection. Bloodborne pathogen, obviously much more applicable to our healthcare sector and personnel that are working in that area. It does not typically cover respiratory secretions as opposed to the California state-specific standard, but it does have the aspect that you need to have the framework in place in order to control or reduce the spread of a virus and exposure for your employees. When it comes to the recording and reporting of COVID cases, this also is something that you do need to keep in mind which jurisdiction you are operating in. I've mentioned California a couple of times as I've gone through this segment of the presentation. California's new COVID regulations are directing employers, if they are seeing 2 cases or more in a particular work site, to consider it an outbreak and to notify their workers' comp carrier, and having the workers' comp carrier begin the investigation. And that can be put an employer and its carrier and the employees, in a bit of a conundrum on making sure that the carrier gets all of the information it needs, and the balancing as well and looking at the employees' motivation of getting treated, making sure that they're managing their symptoms, minimizing the risk of spreading COVID to other people, and then making sure that they are getting the benefits that they're entitled to. So all of those dynamics are in play in California. Right now, under the federal rule, what the recording and reporting requirements focus on is it work related, and in order to meet that standard, it has to be a more likely than not expectation. So outside of California, employers need to be conducting a good faith investigation, looking at the facts and circumstances. When do we think that this employee may have been exposed and contracted it? Who else did they expose? Did we come off of the Thanksgiving holiday or a Christmas vacation where they were spending more time with family, and perhaps there were family gatherings that may have led to their exposure rather than it taking place in work? But those are in a sense, a bit of the details that an employer needs to be examining to determine the work related, and then therefore the recording component of it. Aside from the California requirements that I just mentioned too, what are some of the other rules and regs that the states have put in place? We put a list of them here. Each one of them is going to will vary by the jurisdiction, which again is why you need to be thinking about the specifics of the states where you have people that are working, and they run the gamut of the topics here. Going on to the next slide, what are we going to do as far as the implementation and the continued rollout of the vaccine? The White House currently has an aggressive but hopefully attainable goal on accelerating and expanding the number of vaccine deliveries and opportunities for personnel and the public at large to receive the vaccine. But we do, as an employer, need to be mindful that there will be a transition period where more of the population is getting vaccinated, but we may not be able to abandon or eliminate all of the other precautions that go with it and the protective measures that go with it. And there are a couple of reasons for that. If you keep in mind the clinical trials that were done to develop the vaccine, we're really focusing on the illness itself, the symptoms, and controlling that, and protecting health and life. They were not as focused on eliminating or stopping an infection. So the benefit of continuing to wear facial coverings and masks can still be applicable, because we may have a portion of your workforce that has not received the vaccine and may still be at risk. And you can have a portion that might be infected, but the vaccine has limited the severity of their symptoms or eliminated the symptoms entirely, but you don't know that you are going to be able to consistently or uniformly protect all of your personnel at the same level. So just be aware that that is going on, and that is going to be one of the challenges that the agency and the scientists and U.S. employers are going to be dealing with for the next couple of months. One other aspect of it too will be the mutations that are existing with the virus itself. If we've watched the news in the last week or two, there has been a fair amount of discussion on the variant or the strain that first appeared in the United Kingdom, and that may be more contagious or easier to spread than earlier variants, but the symptoms were not as severe. As of yesterday, and I bring this up more to show how quickly the facts and the circumstances are changing, the president updated the travel ban for people to return or come into the United States, and added South Africa to the list of countries where people that are non-U.S. citizens cannot enter, because of a strain of the virus that is mutated and appeared in South Africa that, again, has higher infectiousness, but also has some greater severity along with it. So in the aviation analogy, I would say that the government and OSHA are still, in a sense, trying to build the airplane as it's going down the runway, because this is an evolving problem, and it is one that we are going to be continuing to move and adapt to as we go forward. There are plenty of resources that are out there that you can take advantage of. Part of what we are going to distribute afterwards is going to be a complimentary vaccine planning checklist that is there. And the advice that I would offer on, from this slide, as well as you're sharing these resources and getting your message out to your personnel, remember that if you are still having a work from home presence and protocol, so that a lot of your folks are not in the office or not on the factory floor, but are doing things elsewhere, make sure that they are getting the message through those new communication channels as opposed to face-to-face with their supervisor. Make sure they're understanding the information and acknowledging it so that they know the resources that are out there. I'm going to wrap up just by pointing out two items and then hand the presentation back to Avi as he comes off of mute. But some of the other things that we will see OSHA probably change will be where the Trump administration had eliminated, in a sense, the naming and shaming of employers based purely on the allegations that were associated with citations that were issued. Unfortunately, we do expect that is likely to return, because Dr. Michaels, as the former Assistant Secretary of OSHA, felt that was one of the biggest deterrents that he was able to use to get employers to change their behavior, because they didn't want to be under the glare of the media spotlight. And sort of as I mentioned a slide or two ago, this is going to be an evolving process. There are going to be a lot of things that will come into play that are going to be new, but we're also going to see OSHA most likely take some of those regulations that have been on the back burner that weren't implemented over the last 4 years and try to move those forward. Workplace violence is probably one of them that would be right, at the forefront of that. It has been implemented to a limited degree for the healthcare industry, and it'll be interesting to see if that is a protection that is put in place across all industries. Avi, are you ready to resume?
I sure am. Thank you, Eric. I just wanted to add a couple things in addition to all the great information that Eric shared. All of this, we're really trying to make our best guess about what OSHA might require in the future. And so, everything we've shared so far really we look at that as trying to read the tea leaves from these different parts, from what has CDC and OSHA recommended but not required per se before, what have various states required, and what have they talked about. So we're trying to get a sense of and share with you a sense of what might be coming down the road. But of course, we really don't know. And honestly, the administration may not know because their team is really just starting to come together. And OSHA has just a couple weeks, I think, to try to figure out if they're going to issue a temporary standard. But remember that they still need people to be put in place and the leadership to be able to do that. So very much a work in progress. The other thing I just wanted to call your attention to that Eric talked about a little bit in terms of our resources that we offer is we do have the Return to Work COVID Policy Generator tool, which is available to you, and we'll certainly circulate that link after the webinar. And that's something that enables companies, in some cases, you might have been working remotely all this time and it didn't really come into play. But once you're starting to go back in person, you need to get your workplace all set up. You need to deal with what travel rules will be, how you handle meetings, how you handle social distancing, masks, and all the rest. This policy generator basically lets you put in your information, and it will pull together a draft policy that one of our team attorneys will then work on with you. And the idea is it sort of does it in a very efficient, both speedy and cost-effective way. And likewise, we've done a webinar in the past on the vaccine issue, and that's something that we'll recirculate in case you'd like to look at it again. And then we've got that checklist Eric mentioned on vaccine planning, and hope to be putting out a vaccine generator tool as well for the future. So I wanted to flag those things for you. We're going to jump to how enforcement may change under the new administration. And here too, it is guesswork on our part, but we're hoping to give you a sense of the context as we see it so you can get a feel for the environment we're looking at. So first of all, looking at COVID enforcement in particular, because again, we expect that to be a very heavy focus in the early months, maybe in the first year of the administration. And the starting point is where we're coming from. So the stats on the screen right now show you the COVID enforcement that took place almost entirely under the prior administration. So this is since March. And we've put up the numbers here for both federal and state. This is something I'll highlight a bit more in a minute as well. But keep in mind, we're talking about the federal government changing hands and perhaps changing policies and becoming more aggressive. But a whole lot of OSHA enforcement is actually done at the state level. And while, as Eric pointed out, the state OSHA plans have to be at least as effective as the federal requirements, and what's effective or not, especially in the case of an unprecedented pandemic, is a big question mark. There may be differences of opinion, and it may be hard to determine what's more effective. But the states have a big role to play, and you can see here federal penalties from March through December, about $4 million in total. In terms of complaints and referrals that were received, 14,000 at the federal level, almost 50,000 at the state level. And then in terms of what became actual inspections, again, 1,500 at the federal level is dwarfed by almost 9,000 inspections at the state level. So keep in mind, we're talking about the new federal OSHA, but there's a whole lot of activity taking place in the states that have OSHA plans. For more high-level context, here's some just background information about how injuries have gone in the last bunch of years and how that has correlated or not with changes in OSHA behavior. So on the left, you can see the inspections that federal OSHA has done. And we've got 2014 through 2019, which is where we've got data. And you can see that, in the last couple years of the Obama administration, we were, over 35,000 inspections, and that dipped a bit in the 4 years since. But it's really not that dramatic. And we've split here programmed and unprogrammed inspections to give you a sense. Programmed are the ones where they come up with the industries that they think are hot issues to focus on. For example, national emphasis programs on manufacturing, for instance. Whereas unprogrammed are where OSHA is responding to stuff, a complaint or an incident or an injury. So you see that enforcement did dip slightly, but it's really not that dramatic. And then on the right side, there's an overlay of what the graph looks like for fatal injuries at work versus OSHA inspections. And so, just as a data point, you can see fatal injuries in 1992, I think it is, we were able to pull over, what is that? I think there's something wrong with that chart. I think it was over 5,000. And then you can see that it dips a bit, but sort of plateaus. Whereas the inspections, again, they did dip a bit from one administration to the next, but not very much. And so at a super high level historical view, these things are not changing dramatically. As we look at the COVID environment, it's helpful to just keep in mind what the spectrum is from the debate that's going to take place. This is a quote from the former chief of OSHA under President Obama, Dr. David Michaels. And, he was commenting on the penalties that have been issued so far by federal OSHA in the COVID scenario. And, he clearly feels that they're insufficient. He said that just to issue one citation under the general duty clause is, quote, a choice, but that they could instead issue multiple citations at the same workplace and classify them as willful, which allows them to multiply the size of the fine by 10. So, a willful citation is a significant one. It's a pretty serious one. They're not terribly common. So he's in this quote, he's pushing hard for very much more aggressive enforcement. Now, that's not the only voice on the spectrum, and we still have to see what the nominee for OSHA and the nominee for Secretary of Labor, where they'll land up. However, this is one of the voices out there, and so people should be aware that there are those calling for a much more aggressive push, whereas others are pushing for more education and more support and more training. A couple slides, again, to frame the context of the state role. More than 24 states that have state OSHA plans. You can see them highlighted here in blue. And here again, just to visualize how much of a role the states have, look at left in COVID inspections. The states had 83% of them so far. And if you look at inspections overall, just in a, quote, normal year, for the issues that arise, again, the states had a huge piece of the action. So I think it's important that we bear in mind that the federal OSHA changes that we're anticipating are only a piece of the puzzle. And as Eric said, they can set the baseline. With that, I'm going to turn it back to Eric.
Thanks, Avi. So folks, wrapping up for today, we thought we'd give you the bottom line slide on really best practices and thoughts on how to prepare for some of the changes that we are anticipating or expecting to see come down the line. So obviously have a plan for dealing with COVID. Being 10 months into this pandemic, we're certain that most of you probably do have one, and you probably built it right as this pandemic and public health threat came into being. My question or my thought would be, how long has it been since you looked at it? Has your team and your group thought if there are revisions that would be useful? Are there things that are in the plan that you thought would be great ideas that turned out not to work well in practice? If there are items that really didn't pan out that are on paper, you should probably have a discussion within your group and your decision makers on the revisions that you would want to make, and take out requirements that you aren't putting into practice, because you don't want to have a spot where your documents are saying that you're going to be doing more than you really are, because that is a hotspot topic for any regulator. As the vaccines become more available, look at the policies that are out there. So we do have the 2 resources that you can take advantage of to be thinking and putting those steps in place. And I highlighted in red the 2 aspects on this slide that I thought are geographically unique and subject to differences, so that you keep an eye on how each state is categorizing the types of employees and people that are going to be eligible to move to the front of the line for a vaccine, and those that may not be eligible to move to the front but would be part of the general population. Keep training and keep communicating, and do your best to encourage your employees and insist that your employees follow the rules that you lay out. It always becomes harder to defend against enforcement action if the policy is written, but the employees are saying that, no, nobody ever makes me put the mask on. I have had fortunate, beneficial situations interacting with California OSHA in the last 2 or 3 months, where construction sites where you have multiple employers, multiple work groups all showing up, the customer as well, which may be a business if it's a commercial real estate and construction project, all may have different levels of sensitivity, and they all have different employee groups that are going to have personal opinions or levels of control and supervision. It is helpful, and it does put you on a stronger footing to answer a compliance, safety, and health officer's questions on why was this person seen not wearing a face covering when they were working indoors around other people, to be able to pull out your policy and then to pull out the records that you have that show across your company, or certainly across that work site, the number of verbal warnings that may have been mentioned in the meetings, the number of construction tailgate meetings where you were reminding the workforce to abide by the rules. If there are folks that didn't comply and they received a written warning, or if you had subcontractors that you were told, that you told the sub, your people are excluded from the property until they understand that they need to follow our rules. Those types of examples of you making a good faith effort and striving to comply will go a long way to help your defense if you are interacting with a safety and health inspector at the state or the federal level. So document, document, document. That's, you probably hear that from every lawyer and every webinar that you're on, but it really does pay dividends because it shows that you're making those efforts. Don't forget to make the recordings. Be aware of if there's information on there that is safety sensitive or personal information that to put on there, but then make sure that the material is being protected from inadvertent disclosure, because some states are going to treat that information with greater sensitivity and greater attention than other states. And go ahead and be ready to schedule your training and with your team and your corporate leadership during 2021. There are plenty of virtual training opportunities that are out there where you can make that happen, and hopefully convenient for everybody's schedule. As far as the folks on our group that are involved in this, you can tell that these are the pre-COVID and pre-facial hair photos, but I'm on the left as well with Avi, and then our partners, Brian Hendricks and Donna Pryor. Avi and Brian are on the East Coast, and Donna and I are both in Colorado, so we do spread it out from a time zone and availability standpoint as well. So I believe that's going to take us with about 10 minutes to spare to see if there are any other questions than the ones that we've answered. And I'll do the wrap-up script and see if we get any other questions in. So we do appreciate you joining us today, and we do hope that you found the information useful for your organization. To remind you that the program has been approved for legal education hours, and to go ahead and click on that CEU icon at the bottom of the screen. You will get a certificate of attendance, including the course numbers, that will be mailed to you, along with a recording of the webcast for you to watch and share, as Avi mentioned at the start. If you would please fill out the survey as well. That gives us a sense of whether we provided you with useful content, whether there are other topics that you want us to address on future programs. Those allow us to put a program together that'll be better and more responsive to your needs and hopefully more enjoyable. So that is going to include the webinar and my part in it. Thank you very much for attending. And Avi, back to you.
Thanks very much, Eric. And, you know, Eric mentioned training your team. I'll just say that that's something that we can do as well. We do work with clients to do training for a flat fee to make it very cost effective, to really train the frontline folks to know how to deal with OSHA to comply, but also if you get an inspection, if you get a complaint, how to handle those well, because how the response goes makes a big difference into what kind of liability, citations, penalties, or more may happen. So we really enjoy doing those. Once upon a time, and once again in the future, we do them in person, but we've gotten pretty good at doing them virtually as well, which has the benefit of being able to do it for an entire national team, for example. So please do keep us in mind for that. I see that we have one question popped up here, and it is a question about CLE. So I know that our team will respond to that as they get a chance to. If there are no other questions, we'll look forward to hearing from you afterwards if you give it some thought, and we hope to see you on the next one of these. Please keep us in mind if there's any way we can be helpful. Take care, everyone.
Bye-bye.